It's now evident that reforms must be undertaken at the National Health Insurance Fund and at the Kenya Medical Supplies Authority so as to fully realize the implementation of universal health coverage. President Uhuru Kenyatta, who launched the biometric registration of the UHC, reiterated that the scheme must be a success as he issued a stern warning against engaging in graft. Our Coast reporter Kevin Mutai also highlights the key pillars the head of state is focused on to bring change to the ailing health sector.
President Uhuru Kenyatta has today launched the biometric registration for the universal health coverage in Mombasa.
The UHC pilot phase was by all means a success story.
This assertion paints a picture that is different from the reality on the ground, and in the words, piloting counties raised concerns on hosting a crippled plan, some having to revert to charging patients.
We have a newborn in town, and this newborn will have teething issues. We'll expect some challenges, but unless we begin the journey, we will never overcome challenges because they won't be there.
The threat of the failure of the plan is real, and the head of state has highlighted 5 key pillars of scaling up the implementation of the program. First is scaling up reforms at the graft-riddled National Health Insurance Fund. Second, establishing a mandatory UHC scheme which will be managed by NHIF and regulated by the Ministry of Health. Then there's the adoption of an essential health benefits package to cover several areas of treatment and is to cost 6,000 shillings per household annually. Fourth is the provision of health insurance cover to 1 million vulnerable households. And lastly, to conduct a biometric registration to vulnerable households in the country.
Today, I direct the Ministry of Health and the Attorney General to fast-track the necessary legislation that will codify these reforms into law and foster the sustainability of the fund.
Leaders want various issues addressed, especially in light of the costly corruption that has been witnessed at the fund.
So nataka kuambia NHIF, look at your statistics. Utakuta kwamba asilimia kubwa sana of your engagement probably is with private hospitals.
As part of the reform to align NHIF to respond to the needs of UHC, we recommend that NHIF be a shared institution whereby county governments participate in decision making.
If you do not handle these funds with the care and caution that it requires, some of us will go to very extreme lengths to ensure that you shall regret it for the rest of your lives.
Kenya Medical Supplies Agency Chairman Kembi Gitura vowed to reclaim the integrity of the institution that has been marred by graft allegations. This follows complaints from governors that the institution is derailing delivery of medical equipment to counties.
Going forward, we shall be using the platform of IFMIS and inviting them to register. As of this morning, Your Excellency, we have about 30 suppliers who have registered with us at IFMIS.
The Ethics and Anti-Corruption Commission is set to finalize investigations involving the alleged procurement irregularities at KEMSA, which birthed COVID-19 millionaires. Kevin Mutai.